Hello, my name is Lea Moser. I'm a current graduate student at the University of Nevada, Reno, getting my master's degree in public health, specializing in health policy and administration with a specialization in social and behavioral health. My internship over the summer was held in Elko County with the Office of Rural Nevada, the Office of Statewide Admissions, and hosted through the University School of Medicine regarding the outcomes of mental health and suicide. I would like to firstly acknowledge my advisor, Summer Friedman, for helping me come up with a strategy for my internship, my preceptor, Gerald Ackerman, for introducing me to Elko County and all the stakeholders that reside, as well as my host organizations, which I previously referred to. The purpose of my project was to better understand how to improve access to mental health services in Elko and rural Nevada. In Nevada, mental health and suicide is among the highest in the nation. In 2019, Nevada's mental health system ranked 48th in youth mental health care and 51st in adult mental health care and access to mental health. According to the Mental Health America, in 2016, suicide was the sixth leading cause of death in rural and frontier Nevada. More Nevadans die by suicide than by homicide, HIV, or automobile incidents. Regarding Nevada's public health agencies, represented in Elko involves the Department of Public Behavioral Health, which coincides with the Washoe County Health District, Southern Nevada Health District, and Clark County Health Districts. These also parlay into rural offices, such as the ones that I worked with while serving in Elko. The purpose of my project was to assess the mental health needs, resources, and barriers in Elko County. After I did that, my next goal was to create a policy analysis comparing Elko County's health barriers and comparing those to other states in order to see if there were any gaps that we could provide additional resources or change policies and laws to better exemplify positive outcomes for our mental health. In order to do this, I had to do a deep mental health literature review of Nevada, in which I evaluated our health systems compared to outcomes in other states to better understand where we were lacking and where we could leverage our resources. In order to do this, I comprised my mental health needs assessment for those of the general county, as well as medical professionals who deal with mental health and suicide. On the left, you can see is a mental health practitioner community needs assessment, which was given to any mental health practitioner in behavioral health systems, in the hospital, or in supportive roles such as counselors at elementary, middle, and high schools. In addition to that, the Elko County Mental Health Community Needs Assessment was provided to the entire county. In order to provide these surveys, I had to partner with community stakeholders such as the Board of Commissioners, which championed the need for better suicide and mental health resources and responses, the Sheriff and Police Department, first responders who attend to these traumatic incidents, Nevada Health Centers, Vitality Integrated programs such as behavioral health clinics, the Elko County School District, Native tribes affected by mental health and lack of resources, the Office of Suicide Prevention, Zero Suicides Elko, Northern Nevada Regional Hospital, as well as survivors of suicide and local community advocates. Results from my survey still being processed due to the lack of responsive survey taking in the hospital, but the general results that I have as of current include 219 participants who have responded by saying that mental health services are lacking and that there's a lack of satisfaction provided in the mental health systems that are currently available. Using this data, stakeholders plan to develop responsive policy that address barriers and gaps in mental health services to reduce suicide in rural Nevada. This includes changing policy and funding structures, increasing workforce in a workforce shortage state, and making access to licensing easier so that we have licensed professionals who can attend to mental and behavioral trauma. The impact of this community assessment increased the destigmatization of mental health and suicide by bolstering conversations around and regarding mental health and suicide with general community members. It increased collaboration between organizations and stakeholders that had previously worked in silos, such as the organizations I worked with and the Elko County School District. Policy recommendations were provided to the Elko County and Rural Nevada Commission boards in order to bolster any of the funding channels that they have currently and to provide information on how to seek grants to support additional resources. The creation of a multi-county health district is now something that is being talked about in the district in order to provide an additional county hospital outside of the privatized hospital in Elko County with a lack of psychiatric beds and little resources for rehabilitation. Increased partnership with health and medical related professionals in rural Nevada is now something that is more available. I would like to thank Gerald Ackerman, my preceptor, for everything he did, including introducing me to the wide variety of people that I met and giving me a blueprint of what a good leader in mental health should look like. The AHEC office, who became my family over the summer in Elko, everyone at the University of Nevada that supported me, such as Dr. Friedman, my advisor, Gerald Dermid, and Melanie Flores. And thank you to Zero Suicides Elko and the Office of Suicide Prevention, who became some of my best friends while I was in Elko.